Welcome to the IPA webinar series. Good evening, India. Good morning, USA. And good afternoon, Europe. So we are with a global audience today. And the presentation today is about the current state of mental health care for older adults in India. I represented on behalf of the International Psychogeriatric Association. And here is an advocacy for our membership. We are organizing the webinar together with a team from IPA. And the task force series I have the pleasure to chair with my colleagues, Professor Myrra Lapid, Dr. Rob Medan, and our colleague Christian Tranley, the IPA program manager. The IPA is a global organization for mental health for older people. And the format of our meetings is that we have a duo presentation. Today, we also have two speakers. We deal with one theme into depth. And what is very important in our meetings is the Q&A. So we really encourage you to put questions in the chat so that we know what you are asking, and you can put these questions into the chat immediately also during the presentation. So I have the pleasure to announce two speakers of today, but not after making you aware of the IPA conference in Japan in September this year. And yes, I already started announcing. And the presenters of today are Professor Sivakumar from Bangalore and Dr. and Mr. Premkumar Raya. And the first speaker of today is Professor Sivakumar. He is a founding member of the Geriatric Psychiatry Unit in the National Institute of Mental Health and Neurosciences in Bangalore, India. He has more than 20 years of experience in clinical services, training, research, and advocacy in the field of geriatric mental health. He is involved in important research initiatives, and he has over 100 peer-reviewed publications. And his talk is about mental health care for older adults in India, challenges and innovations. Professor Sivakumar, the floor is yours.
Good morning, and so good evening to people joining from India and other parts. I think we have different time zones. So I will be sharing the screen. So at the outset, I would like to thank the IPA for giving this opportunity to share about the challenges related to mental health care for older adults in India. And my colleague, Dr. Mr. Raja, also will be sharing about the other perspectives related to NGO. So I would be addressing a few important issues related to this topic. So first, to look at the magnitude of the mental health problems in older adults in India, and what are the strengths of the mental health care system in India, and what are the important challenges for the mental health care for older adults, and what are the initiatives for improving the mental health care that we have taken, and what is happening in India as of now. So I think most of you would acknowledge that India is one of the large countries with a huge population. The older adult population is, as of now, India is still considered as a younger country in terms of the proportion of older population. We are about 10% of population is 60 and above. But in terms of numbers, it is already around 150 million. And it is projected to increase rapidly and more than double by 2050 to 350 million. almost 1 in 5 people have mental health problems, estimate around 30 million. As in other places, depression, anxiety, and dementia are the most common problems. I think we are having an advantage now in India for advocacy because of the data from nationally representative sample studies of longitudinal aging study in India, which indicates 30% of population have depressive symptoms, significant depressive symptoms, and almost 8% have clinically diagnosable major depressive disorder. The anxiety prevalence is also around 8 to 10%. And the recent studies also have estimated the cognitive impairment. The mild cognitive impairment is around 17%, and major cognitive impairment is around 7.2%. So this is estimate based on this, almost 8 point, maybe around 10 million people may have dementia as of now. By 2016 population, it was around 8 million, and now it is further estimated to increase. Now, what is also more important is the higher prevalence is there in rural population, women, old, and those who are having medical comorbidities and those who are from residential care. Most of the surveys have not included population from residential care. Now, for a country of a huge size, there is a lot of diversity, both in terms of elder population. The south and the west have more elderly population, and some states in the north. The central part and predominantly the northern states have still less of older population. This is primarily due to the growth and development indices in terms of education, literacy, and the other indicators like fertility rates. So in India, when we talk, it is equivalent to multiple smaller countries, the size. One of the states is equivalent to maybe Uttar Pradesh is a very, very large state, which is equivalent to many countries. Now, compared to the population in North, the South is almost like the developed countries where almost 16-17% of them, particularly in Kerala, have elder population. And this is projected to increase rapidly in the next 2 decades. Now, coming to the challenges or the factors which influence the mental health problems, I think one of the important issues is about treatment gap. Almost 80 to 90% of the problem people who are estimated to have mental health conditions never receive diagnosis or treatment. Only 10% actually are seen in the clinical settings. As we know, mental health conditions have a significant impact on physical health issues. It also contributes to disability and increased mortality risk. Now, the data from the longitudinal aging study of India actually demonstrates these findings in terms of how many people are having impairment in, say, complex activities, how many people have comorbidities in terms of physical health conditions. So these are quite replicated, whatever the global literature is replicated in Indian settings also. Now, I think one of the important issues in Indian settings is also low awareness. So even conditions like dementia, almost 70%, 80%, they consider the presentation of dementia as normal for aging. So there is delayed help seeking, or they seek help only when there is an advanced state. So again, because of the low awareness, a lot of people have myths and misbeliefs, and even now, even educated people actually seek traditional or magico-religious beliefs. They have magico-religious treatments, including those treatments which actually does physical abuse to the person with mental health problems. It is not unusual to hear such experiences from our patients. Stigma, again, is another important factor. One of the patients recently told that they want to keep the knowledge of this condition, the person having bipolar disorder. They didn't want the daughter's family to know. They were worried about what will happen to the outcome of the marriage, despite this person having 20 years of illness. So they have to maintain a lot of secrecy despite having challenges of caring. So that is the kind of extent of stigma as to how within the family they will treat. Ageism is not simply because of in common people, even medical professionals. We had an experience where a person who is a physician in US actually understood the problem of depression and negative cognitions in the mother as a normal wish. So why don't we facilitate euthanasia for a person who is having severe depression rather than treating? Now this person, after treatment with ECTs, is got back to the premorbid functioning and doing well for the past 2 years. Now, elder abuse, again, this is another important thing what we see. recently, one of the patient whom I've seen, the person with dementia, is locked up in a room where it is treated almost like a where everything happens within the room and no proper care is being given by the family members. They have a lot of constraints in ensuring the safety of the individual. There is a need for proper social care facilities for people who don't have affordability. So our collaboration with NGOs actually addresses some of these areas. So we are working towards placement of this individual in a proper care facility. Now, we also need to acknowledge the positive aspects. A lot of people now are centenarians are there. People are in good health. I think positive aging and even many of the caregivers for the younger persons with mental illnesses or older adults. So that way, resilience is also another important factor. I think when we address the mental health, we need to look into both positive as well as negative aspects. Now, the health system in India is organized in different tiers. We have the primary health centers and the health and wellness centers, which form the basic units. A lot of emphasis are given now to develop services there. And the basic community health workers are being trained to recognize the mental health problems and provide initial treatments at a doorstep level. And for the last 20 years, there is a district mental health program, which has been gradually scaled up to almost all the districts in the country, more than 700 districts. And there are elderly care programs, which is under National Program for Healthcare of Elderly. Again, this is being scaled up gradually to most of the districts. So this forms the outreach services at a different levels in the local population. And the referral centers or medical college departments or district hospitals, and then the state institutes and the Apex Institute like NIMHANS, my institute, where people from all over India come. Now, parallelly, we have private health services, which is not connected directly to the public health system, and people have freedom to seek help anywhere. And the long-term care and rehabilitation services are predominantly by the non-governmental organizations. And there is also a significant proportion of traditional health systems, which includes yoga, Ayurveda, and various other traditional health systems in the country. So one of the challenges in this health system is the interlinking and coordination is difficult. People can go to anywhere and any place within India without any need for referral system, and it is not coordinated, and it is not the follow-up is not guaranteed. So it is basically left to the person to seek help from anywhere rather than the system coordinating from where they have to take the treatment. Now, there are some strengths for the mental health care system. I think community-based services are predominantly functioning based on the role of the family caregiver, which is our strength. There is almost 80 to 90% of the patients with dementia or other mental health problems will be with the family. We don't have waiting times because people can seek consultations anywhere. This is an advantage in one way. They can get investigations done without much of waiting time. And now the scaled up services are available in almost every district. Maybe 15 years back, there are districts where there are no psychiatrists are available. And the expansion of medical colleges again has improved the care facilities available. Public health systems offers free or subsidized cost of mental health care, and which is available across the country, particularly more in South. There is also scaling up of telepsychiatry services, and a lot of importance at the government level for the recognition of the need for elderly is happening recently. Now, the most important challenge is inadequate human resources. Compared to the size of US and India, we have more psychiatrists in US than in India. And there are around 8,000, 9,000 psychiatrists available as of now. But the newer trainees also, there are 1,200 people are getting trained every year, which is not adequate to actually provide only specialist care for the people who are having this vast, huge numbers. So we need to, we also have inadequate access to mental health services at home. Somebody who's frail, who's not able to seek help in a hospital, do not have doorstep services for psychiatric consultation or even the care. And residential care centers are quite large in number. They don't have easy access to mental health care at their doorstep. So lack of integration, I talked about, that is again an important issue. And inadequate access for psychological intervention, which is very important in elderly. But even in a tertiary care center, it is not easy because of language diversity and shortage of human resources. And there is also the inequitable access in rural areas and people from low socioeconomic status. So they have difficulty to travel to the main centers for accessing treatments. Now, also in several in certain regions like northeast and central regions, the availability of services are less. In the private sector, the out-of-pocket expenditure is high. So the public health system offers free, but the private health system insurance is not there for social care, and many of the people outpatient care will not be covered by insurance. Now, some of the initiatives for improvement of mental health care, I think we all recognize the need for public awareness. So there are initiatives done by multiple organizations, including NIMANS and various NGOs to promote public awareness programs. We run a program for the last 3 or 4 years to conduct direct outreach programs and webinars to promote awareness. We have released a couple of books for awareness of mental health issues as well as healthy aging, and several materials we have released. And there are lots of collaborative initiatives with association with NGOs. And the recent Mental Health Care Act actually is a welcome step because of rights-based perspective, and it assures services. But again, from the what is available on paper to implementation on the ground, there's still a long way to go. There are several reforms that have taken place. For example, the unmodified ECT has become illegal now, so it is not available. People have to register the mental health care institutions within this, so that there is some oversight is available, which can help in prevention of abuse and bringing out standards. Now, technology again has got a big boost. National Tele Mental Health Program is a recent major public health initiative launched by the Government of India with a huge investment, and availability of service at a telephone call is available in all languages across India, which is a major step, and elderly people can make use of this to a big extent. And integrative medicine again is something which is available predominantly as at the doorstep level in the local population. And another major initiative that has happened is a free health insurance for inpatient care, which is given universally for people 70 years and above. This is not only for mental health, it is for general health care also, and which we are also able to benefit. The Mental Health Care Act actually ensured that mental health treatment is covered by this insurance. Earlier, the mental illnesses were excluded from most of the insurance policies. So this is a welcome step which has promoted inclusivity of the mental health issues. Now, this is a kind of book what we have released. We have also released in the local language Kannada. Translation in other languages are happening. This promotes awareness on various topics related to mental health and healthy aging. I talked about the National Tele Mental Health Program. More than say 1.4 million calls have already been reached. There are 52 centers, and various languages are being available. Services are available in various languages. That is one complexity for India. There are more than 20 languages people speak. So we need to have services available in different languages. I think this is becoming one of the important model initiatives. And the scaling up of human resources is happening through training, health workers, doctors, and volunteers. Online training has actually strengthened the expansion of training opportunities, hybrid courses. NIMANS has started a NIMANS Digital Academy. This has strengthened a lot of training initiatives. We use task sharing approach by training of physicians and lay volunteers. There are courses for that, and then geriatric training is also given for them. Training of paid caregivers from different agencies are also done. And family caregivers, again, WHO program, iSupport program is one of the important initiatives that taken place. And NIMANS and the Dementia India Alliance collaborate for online support program for dementia caregivers. So there are also need for specialists in geriatric mental health care. That is one of our mandates. We have initiated specialized training courses. NIMANS and King George Medical University are the two apex institutions, one in the south and one in the north, providing specialized training for geriatric mental health as of now. We have NIMANS has fellowship courses for 1-year fellowship in multidisciplinary fields, both for social work, psychology, nursing, and psychiatrists. We also have a 3-year course, which is modeled for specialist registrar training of UK, which is called as a DM geriatric psychiatry. Now, there are other initiatives like task sharing interventions, the effectiveness has been trialed in Indian population. One of the group from Goa, in collaboration with centers from US, have studied this depression in late life intervention to prevent depression, which is a very important landmark study. We also have studied of the compared the effectiveness of right unilateral versus bifrontal ECT in a recent randomized control trial. There is a randomized control trial of transdiagnostic CBT in older adults with mental health problems is ongoing as of now. We have been working on transcranial direct current stimulation, including personalized dose estimation using artificial intelligence. So this is some of the novel interventions what we have been developing, including domiciliary TDCS, where the caregivers are trained. And we recently have completed 2 patients where more than 1 month of transcranial direct current stimulation is given by the patient caregivers after training. So this is for various behavioral issues as well as cognitive function we are able to use for cognitive disorders. And recently we started the PET amyloid imaging in India in our center to differentiate Alzheimer's and frontotemporal dementia. These are not available for clinical studies as of now. It is only for research we are having. So what happens is this non-availability of these biomarkers at a clinical service level or a regular level prevents using clinical trial in Indian settings. So we almost don't have clinical trials of new disease modifying drugs from India. A huge population gets excluded, but nowadays we have started getting requests for enrolling in newer trials. We are exploring participating in those things. So traditional interventions, again, we are studying through clinical trials, and lot of funding from philanthropic and corporate organization is supporting the promotion of mental health care for elderly particularly. I think this is one huge welcome step. I think many of the NGOs are getting a lot of support. This is a very, very important initiative. And we collaborate with a lot of non-governmental organizations. The Indian Association of Geriatric Mental Health has around 400 members, but exclusive geriatric psychiatry practice will be there only for around 15 to 20 people. But most of them practice both adult and geriatric psychiatry. Now, this is one of the papers what we recently published about personalized dose selection for people with neuropsychiatric disorders using TDCs. One of my colleagues, Dr. Sagarika, had developed this technique. And we are using this method for language variant dementias. And one of the NIH projects where brain age gap is being studied in collaboration with University of Southern California. This is an initiative called India Enigma Initiative for Global Aging and Mental Health, which is again an important initiative to understand the risk factors and the protective factors for brain aging. And the longitudinal aging study of India is a very, very important study which has contributed to the data on the prevalence, incidence, and risk factors. NIMANS is also part of this study. And this is giving data for advocacy to promote services. I think this is a very important contribution. And to conclude, the need for geriatric mental health care in India is increasing rapidly due to population aging. But however, public health approach is required to manage the challenges as we don't have enough resources to provide a specialized care. And we will never be able to reach the required specialized care for the population, what is required, the population having mental health problems. So we need to use task sharing approach and then train various stakeholders. And the services have to be strengthened with the collaboration with non-governmental organizations, particularly for the social care, which is a huge issue where we have to integrate healthcare and social care. And NIMANS, in collaboration with Nightingale's Medical Trust and Dementia India Alliance, we are demonstrating such collaboration, which you will be hearing from my colleague, Mr. Raja, in the next presentation. And specialty training has an important role to develop leaders. So which again is our contribution. There are people who have trained from us and then have started services across the country. Thank you very much.
Thank you very much, Professor Sivakumar, for your very informative lecture. And I'm very much impressed by all the efforts to improve care. And now I want to give the floor to Mr. Premkumar on the NGOs, and you already announced it. And well, I'm very curious about your talk. Mr. Rama, the floor is yours.
Hello, everyone. And I'm Premkumar Raja. I represent 2 NGOs, non-governmental organizations. One is Nightingale's Medical Trust, and another one is Dementia India Alliance. And At the outset, I wish to thank IPA for giving me this good opportunity to share our experiences. My colleague, Dr. Sivakumar, has already spoken a lot about mental health in India, mostly like from government perspective, and I'll be sharing our perspective from from NGO angle. And I have been personally involved in aged care since 1996 by rendering medical help at the doorstep of the elderly. So we are sort of pioneers of home care in the country while rendering medical health. At the time, we could see a lot of problems, especially the mental health issues of the elderly. Elders were physically fit, but they used to call our doctors and nurses to their homes to render services. At the time, only we found out there was an acute problem of loneliness. The elders were living alone. They didn't have anyone to take them to hospitals, or they didn't have anyone to talk to them. That made us start Nightingale's Medical Trust in 1998. And since then, we have been running various programs for the well-being of the elderly, with special focus on the mental well-being. And second part of my presentation, I also talk about Dementia and Alliance, and they are a founder member. So where we try to do a lot of work, like to promote the cause of dementia. In India, there are a lot of NGOs. It's not that only Nightingale's Medical Trust and Dementia India Alliance are there. There are organizations like Alzheimer's and Related Disorder Society of India who have been doing very good job, like in dementia space for quite some time. And there are many more people working. And this presentation will be sharing only out of our experience. Well, from an NGO angle, when we talk about, yes, clinically, Dr. Sivakumar spoke very well about it, but we see our perspective is slightly different. When we talk about an elder, we see whether the person is happy or not, healthy or not. So this is what the two things we always look at it. And before starting Nightingale's Medical Trust, we had a lot of interaction with senior citizens, both at home as well as at institutions. So at the time, talking to them, we found out a few factors which were responsible to make a senior citizen healthy, happy, and also mentally all right. So this is the basic principle of us, and what we could find out. So elders, for them, health is very, very important, physical health and even mental health. Then next important thing is the loneliness, social well-being, where the elders generally they get disintegrated from the society. Third thing is abuse, that elders generally, because of the age, getting exploited, abused, ill-treated, neglected, and financially insecure. India, we don't have adequate social security systems, and most of the elders are not covered under pension scheme. And besides, there's also a huge dearth of getting trained caregivers. So these are 5 matters making elders not happy, affecting the mental health. And keeping these principles, we try to come out with some practical solutions to make them happy, and thereby keeping them mentally happy as well. So when we talk about the challenges faced by the elderly, related to mental health, these are the 4 broad factors. So they are generally social isolation. That's a very important factor. Secondly, the poverty is one of the important problem in our country. The people are not able to maybe avail the services, and there are a lot of stigma related issues. And again, the accessibility of healthcare. Only few people can access, and there are a lot of issues with accessibility and affordability. And you all know, pandemic has brought in a lot of new challenges, especially into mental health. And people have become, especially elders, become more lonely. They isolated themselves from the mainstream of society, and fear, and with a lot of anxiety. After the pandemic, we could see a lot of changes in the well-being of the elderly, especially in the mental health. These are the areas where NGOs play an important role. I know government does a lot in a country like India, where we have huge number of elders. Government plays a huge important role. But at the same time, NGOs' role also equally important, especially these are the 5 major areas. They are quite active in rendering the services at the grassroots level. So it be counseling, or it could be therapy, or it could be the need-based support services, what are required. And NGOs also play an important role in building awareness and advocate, like, I mean, for the rights and privileges of elders. They are actively involved in training programs or capacity building programs, and also their role in fostering collaboration with various service providers and government is quite important. And also, as they are quite active at the community level, they are able to, like, I mean, organize programs like support group meetings, or maybe they involve volunteers more actively in promoting the mental health. Now, let me talk about Nightingale's Medical Trust experience. Well, generally, the time when we started Nightingale Medical Trust, old age homes or nursing homes were seen as a solution for the problems of the elderly. But you know, the problem in the scene in India, we have 150 million elders, and out of them, 20% or all, may they have mental health issues. How many institutions we can build, like, you know, to address the issues of the elders? Obviously, the programs in India have to be community-based or family-based. So this was the basic principle. That's how, like, I mean, we started focusing more on family-based and community-based support system. And our approach has been holistic. We know that, like, mental health cannot be addressed by one particular service. It needs holistic approach. So we have different verticals: promoting healthcare, promoting financial security, combating elder abuse, and also promoting a safe and secure environment for elders so that lead a life with dignity, and providing services to see that elders are not lonely or they are integrated with the society. And finally, like, I mean, maybe organizing various capacity building programs. So this is under our healthcare programs. We started with home care. I told you it's a very, very unique program offering all possible support to elders who are not able to go to hospitals to avail services. And but the two major areas under healthcare, one is dementia care. I'll talk more in detail. That's a very important service. We are one of the leading NGOs in the country offering comprehensive dementia care. And active aging, it comes under our preventive health. So we have two types. One is online active aging. It's a research-based program where we offer programs with three components: so social, cognitive, and physical. And also we have mobile active aging programs where we take a team to nursing homes or old age homes to render these same services at free of cost. Under dementia care, we have both daycare and residential care. And residential care, again, we have different models. As an NGO, we always try to come out with innovative solutions. So one is we have a main center where it's sort of a hub for us, where with using multidisciplinary team, we try to take care of patients at any levels. And also to reduce, because in a country like India, cost is very important. Unless the services are affordable, people may not appreciate that. Keeping this in view, we started a center leveraging technology. So there, the cost we could bring down by 35%. It's located about 60 kilometers from us. And also we have, in view of the demand, we have only women dementia care facility. Well, this is some of the pictures, like, I mean, of residential care facilities and daycare facilities. We also come out with a model daycare facility. So where we have every day, we have about 40 elders coming, and morning to evening, like, I mean, we engage them with meaningfully. And admission happens with careful, like, I mean, assessment. Then later, like, I mean, care plan is done, and based upon the care plan, person-centric services are being rendered. Well, this is a second important ad service that, like, because as I told you, financial security is very important. In India, about 89% of the elderly are not covered under social security scheme, and they're not getting government pension. So they have to depend either on children or maybe on their own savings, but many times it's not possible, it's not adequate. So we have a program identifying elders who are physically fit and helping them get suitable jobs. So we periodically organize job fairs, or maybe actively involved in promoting the skills so that they can take up the job, and adapt to the present day job requirements. So here we see, like, I mean, how job fairs handled and training programs through which we try to make them re-employable. Elder abuse, it's not only India, everywhere. It's a very serious problem. Elders, because of age, they're ill-treated, mistreated. abandoned or whatever the problems. This really causes a huge amount of mental stress on them. It's a very, very serious problem. And as an NGO, when we were trying what would be the best possible solution, we felt like we had to join hands with the law enforcing authority. In 2002, we signed a MOU with Bangalore City Police, and we have an office inside. So joint program, and it's a toll-free number. Any elder in distress can contact us on toll-free number, and we have an excellent team, committed team, qualified team, and they are able to address the problems quite carefully. And our success rate is over 70%. Problems, any type of problems, like it could be children mistreating them, or sometimes like tenant not vacating the house, financial cheating, it could be property related issues. All these problems, like we are able to help elders. This really ensures better mental well-being of the elderly. Well, a city like Bangalore, definitely safety and security are very, very important. And elders become soft targets for crimes. And also now with cyber crime increasing, like, they have a lot of fear, and also they are not able to access few services because of that. So constantly we organize programs like, on digital literacy, as well as programs like, are imparting on cyber safety, etc., along with the police. As I told you, that loneliness is a very, very important problem. It is emerging health concern, and we started with enrichment centers, morning to evening, like organizing various activities in a very senior-friendly environment to fulfill elders' social, emotional, and physical needs. We also have programs for the marginalized. There are for urban poor, going to the area, their areas, and running a similar program to fulfill their social, emotional, and physical needs. We also have programs for the homeless. We have Sandhya Suraksha, where we work very closely with demands. Like Dr. Sivakumar's organization, they render all possible mental health programs there. We have Sandhya Kirana, it's a daycare center, again for the marginal. All these programs primarily to see that elders, because the people from the marginal, maybe from the lower income status, like, they are very much like affected mentally. And here we have different interventions to see that they are like, the life becomes better through this. And finally, capacity building is very, very important. A country like India, where like, it's an emerging problem, you need like, sort of the huge dearth of trained caregivers, not only in aged care, but also like, dementia care. So we constantly train caregivers in dementia care, geriatric care. Well, we also involved in life-saving services. Well, now to talk about Dementia India Alliance, it is like, seeing the plight of maybe the family carers or family members of those like with dementia. We felt India needs a strong and vibrant national organization. Of course, Alzheimer's ARDSI is there, but still, like, we felt India needs more organization. That made us start Dementia India Alliance last year. It's a non-profit organization, national organization. It's a professionally managed national program. And, in India, we have about 8.8 million elders with dementia. This number is expected to double in another 10 years. And the cost of care, because here, since we don't have insurance, so this is mostly like, families pay for it. So now it's estimated of almost close to 15 billion USD. That's a cost of dementia care. And then that cost is expected to go up almost 37 billion USD, maybe in another 10 years time. And here, when you talk about 90% of the cases are not like, getting the diagnosis. That's a very sad part of it. So a lot to happen in a country. And, still in a country, it is not considered a healthcare priority. We don't have adequate policies. So we need to do a lot, like, to create a ecosystem where, like, sort of this important mental health issue is addressed. So this organization primarily, like, sort of started with the family carers as well as those working for dementia. And we have very eminent people part of advisory board, and as well as we work closely because it's a networking is very important. It's a time we need to work with like-minded organization. We work closely with the Ministry of Social Justice and Empowerment, the Government of India, NIMANS, state level mental health institutes, national organization, Vayavikas, Association of Healthcare Providers, then National Accreditation Board of Hospitals, Association for Senior Citizens Living. So many people, like, we work closely with the like-minded organization and Center for Brain Research, Common Age. So this is how, like, I mean, we try to do a lot of things, like, I mean, in this space. And our services, when you talk about, we have national support line or helpline, where we try to offer free services, information and guidance and support. And, in a country, the huge dearth of specialists or memory clinics, and there's a lot of stigma attached to it. So we have online memory clinic. We call DEM clinic. It's a very, very innovative approach where, like, I mean, anybody, anyone part of the country, they can avail these unique services. We have experts part of it, even doctors part of it. We try to offer, like, I mean, all possible support. It's like a memory, it's a, well, it is sort of a digital, or maybe it is a virtual dementia clinic. We also have the training, public education, that's very important aspect. Regularly support groups are organized. We also make hospitals dementia friendly. We also work towards making old age homes, nursing homes as dementia friendly. And we have a directory of service providers. We also organize regularly awareness programs, conferences, and workshops. To talk about maybe that our maybe the one is we made one of the states, government of Karnataka, as part of our advocacy efforts, and already announced dementia has a healthcare priority, and the NABH has come out, like, I mean, the checklist to make hospitals dementia friendly. We feel it's a major breakthrough for us. We know that, like, I mean, we estimate about 7% of the people going to hospital are fear to have this problem. And we feel that, but hospitals are not geared up to take care of elders with dementia. So we are trying to make hospitals dementia friendly. And we also, like, I mean, come out with state action plan in Karnataka, and through which we work with NIMANS and other organizations in organizing various support services. So finally, to conclude, these are the major takeaways. As Dr. Sivakumar already mentioned, like, on mental health is a very, very important aspect of elders in a country. It is growing with a number of elderly, and NGOs play very, very important role, because our approach is different, and our approach, like, and we are community based, and we try to come out with a more holistic approach, and where we try to integrate mental health, physical health, social health, and also, like, an economic health, so that, like, I mean, services are like an integrated, need based and innovative. And programs, like, I mean, our approach, it's a very community based, like, very much, like, I mean, involving the community, so that the services can be sustained and scalable. And also we play a very important role in protecting, or maybe in organizing awareness programs, and also come out with right advocacy programs to make government come out with necessary policies, etc., to address this important problem. So with this, I would like to thank the organizers for giving this opportunity. I think I have done within 15 minutes.
Thank you very much, Mr. Raya, for giving us an insight into the impressive care by NGOs. And I want to have a first question. How is the role of NGO compared to regular care? So which is the largest one? Can you give a brief information on that?
Well, obviously, like, I mean, when you see as a service provider, government plays an important role. Because a country like India, yes, private players.
The sound is.
Oh, sorry, you're not able to hear?
I can hear. Hello.
Yeah, government.
Mr. Raya?
Yeah. See, a country like India, definitely government plays a major.
There is a problem in the sound.
We are able to hear, Myrra.
I will go to the.
Hello. Can others hear?
Christian, can you do something on the sound?
Sounds good to me. I can hear everything just fine.
I can hear.
Yeah.
I think, Myrra, your audio might be a problem. I think we are able to hear you, and we are able to hear the response from Mr. Raj also.
Yeah. See, country like India, definitely government plays an important role. If you want to make a larger impact, only government can do that. At the same time, for an issue like mental health, NGOs have a huge role, because here NGOs, here you have a lot of freedom.
Sorry, Christian? I
Myrra,
can't
can you hear
anything
us?
anymore.
You can't hear anything.
Or they're not able to hear.
No, I think only Myrra is not able to hear. Rob, are you able to hear?
Christian?
Yes.
Yes, I'm
Yeah.
able to hear everything. It's good.
The sound is not good with me. Is the sound good with
Good with me,
for
Myrra.
other
It's good.
persons?
It's
Or
good.
is it my problem?
It appears so. It appears because most of the people are able to hear.
I'm very sorry for this disturbance.
Okay, maybe I think
Christian,
Chris.
can you answer in the chat whether my
You want
connection
me
is
to-
disturbed or of
You want me to
everyone?
answer through chat, or you want me to talk?
I'll reply. I think, audience.
I would go ahead and answer the question. I will work with Myrra on the audio.
Yeah.
Thank you.
Yeah.
Can I answer now?
Yes, please. Yes, please.
Yeah, so as I told you, a country like India, government plays an important role in promoting the health of our people. All the same, when you talk about the problems of the elders and also mental health, NGOs play an important role. Okay, NGOs, one is like, I mean, know with the way they work, the whole that is different from how government works. So here, the people, like, I mean, know maybe they're working in NGOs, they work at grassroots levels. Secondly, they also, like, I mean, know work with limited resources. So they have to be quite creative in their approach, or their approach should be they have to be quite innovative. And when you work with limited resources, but you want to reach out to more people, your approach should be very, very unique. And here we have more freedom, like whereas in government, sometimes even to do something like the procedure will be quite long. But NGOs here, we have the flexibility in the sense like, I mean, we can try many things and we can change the things, and we have that type of freedom. And NGOs again, like I mean, now in country like India, so NGOs, if we have good governance, we can definitely raise a lot of resources when you have, because that again it depends on the governance. If we have good governance and comply with government rules and regulations, now we will come out with CSR, even corporate support NGOs, through which we can raise resources and we can reach out to more people. So I feel NGOs definitely play a very, very important role in promoting the mental health of older persons.
Great. Thank you so much. It looks like we have another question in the chat here. It's how would you plan to reach rural individuals with dementia and their caregivers who are financially disadvantaged? It has been observed that access to NGOs and daycare centers is often limited to those who are educated and financially stable and live in cities. So, Mr. Raja, that sounds like a question for you, but Sivakumar, you are welcome to answer as well.
Yeah, it is a very important. Sorry, Dr. Sivakumar, you want to answer?
Yeah, I think I can address this because primarily it's about rural areas. The reach of NGOs are still quite limited in the sense that primarily the reliance on care is on public health system. The private health system is more for secondary care or primary care, but for a specialist conditions like mental health problems, there is a lot of emphasis on the public health system and the mental health program. But even the public health programs are more effective in the district level. When you go further, the implementation is much more challenging. So NIMANS has currently launched a pilot project, what we call as a Taluk mental health program, model Taluk mental health program. We have adopted one Taluk in southern Karnataka, in the Karnataka, and one Taluk in one of the northern states, which is a very remote terrain, which is a hilly area. And we are through a charitable organizations funding, we are actually piloting as to how we can improve the mental health care system for ranging from the complete lifespan, from children to elderly, using a very, very nominal kind of resource. We are just hiring, for each primary health center, 2 healthcare workers, basic healthcare workers dedicated for mental health, and then trying to use the government resources and various other local resources to improve the mental health care from prevention to rehabilitation. 1.5 years we have already been doing in this field, but lot of challenges are there in translating the evidence-based care to the local population at the village level.
I just want to add, because regarding the daycare centers for persons with dementia, yes, definitely. Like, I think we have to be sensitive. Like, I mean, know in taking care of those who cannot afford. Also, definitely the cost of care is quite high, and any private organization for that matter, when they try to render this type of services, cost is an important factor. And now again, government has come out with an act, Mental Health Act, and when you want to comply with that type of act, cost goes up. See, in NMT, Nightingale Medical Trust, our commitment is we serve all the segments. So there are some people, I mean, maybe services, daycare centers where we charge. People who can afford services, we do charge. At the same time, there are some centers we don't charge at all. That's completely free service. We call it Sandhya Kirana, etc., where we take the help of government. Government provided free place to us, because city like Bangalore, place is very, very important. Utilizing government, and also that we network with demands like organization. There they provide, like, I mean, their expertise in promoting the mental health of the residents. And as I told you earlier, now in a country like India, if an NGO is managed well, the governance is good, definitely there's no dearth of resources. There are good corporates who are willing to give financial support to run such centers. So it all depends how you run the organization. And if you run well, definitely, like, I mean, we can plan it in such a way that marginalized people are not deprived of quality dementia care services. And again, another thing is that now technology, it plays a very important role. As I told you earlier, like, I mean, for one of our residential care centers, we brought down the cost by 35% by leveraging technology. We work with hub and spokes model. This is a model required for India, where, like, I mean, now we are very confident we can set up this type of models anywhere, and we'll be happy. Through this forum, we want anybody wants to run programs anywhere in the country, through Dementia and Alliance, Nightingale Medical Trust would be happy to, like, I mean, offer all technical expertise to make services affordable to anyone, and also affordable and also accessible.
So I'm just going to step in to assist with moderating. There's 2 more questions. We've got about 7 minutes. So it's a question from Miriam Park, and it says, I'm not sure whether the older adult population in Bengaluru is relatively homogeneous, but what are your views generally of how to manage the different views, expectations, and norms amongst older adults of various cultural and socioeconomic backgrounds?
Yeah,
That's the first question.
I think it is true that the population in a city like Bangalore or anywhere in India, if you take, a lot of heterogeneity will be there. And Bangalore is something very unique because people from all over India come there. If you actually, the kind of clientele whom we get, the kind of profile we get, it is from not from just local population. And institutions like NIMANS gets people from predominantly from lower socioeconomic status, as well as people who are referred to us from all over India. So the expectations in terms of services again differ. So we need to understand their cultural backgrounds. So predominantly people manage with a home-based care or a community-based care for any mental health condition. But what we have seen is the requirement of support services, both in the hospital care or for long-term care, is increasing very significantly over the last few years. And this is likely to increase further because women are getting employed, more employed, and the availability of caregivers at home, family caregivers' time to manage is again changing. So with more development, the needs of caregivers, both in the upper socioeconomic status and lower socioeconomic status, is increasing. It is more becoming, there is a need for formal care support systems. What used to be taken for granted that family will be able to manage. This is a reality which people are facing now. It is no longer the easier thing that for the family to manage. And I think we have been addressing these issues by developing services catering to each of these population. And NGOs are also contributing to that.
Okay. One more question, and then maybe we'll talk about upcoming events. This might not be the easiest question to answer. Is there any data or estimation on the current percentages of people diagnosed with dementia and not diagnosed in those getting treatment, both rural and urban? So percentages of people diagnosed with dementia or not diagnosed with dementia and getting treatment, both rural and urban.
So the best data available at a national level from a representative population is from Longitudinal Aging Study of India. There is also a sub-study called Longitudinal Aging Study of India, Diagnostic Assessment of Dementia, which are similar to the health and retirement studies and related studies looking at dementia prevalence in many countries, including US as well as other countries. So these are NIH-funded studies. And in these studies, the information is only 10% actually get diagnosed. Most 90%, if you look at the self-reported diagnosis, people do not seek consultation and not diagnosed. This is also corroborated with the data from the National Mental Health Survey, which has looked at all the mental health conditions ranging from depression to other disorders like psychosis and bipolar disorders. So we have information on dementia as well as other psychiatric disorders. I think this is the most reliable estimate. The proportion of people who are not diagnosed is likely to be higher compared to maybe in other countries, developed countries, it may be around 60% or something like that. Even there, the challenge is there, but here it is 80 to 90%.
Okay, thank you. So in the final minutes, we're going to just pause. Christian, are you able to put the links into the chat for the other? Oh, here we go. Okay, wonderful. So in the chat, we've put some links. So there's the feedback for today's webinar. So if you could please do the survey to let us know how we did. And there's the IPA Congress, which is in Japan, Kanazawa, in September 2025. So please check that out. We have IPA on social media, so there's a link for that as well. There's the International Geriatric Mental Health Rounds. On March 21st, Dr. Morris Friedman, who I work with at Baycrest, will be talking about the game-changing approach to neuropsychiatric symptoms in dementia, a wonderful novel program that we could present to you. And Sivakumar actually presented at these International Geriatric Mental Health Rounds last week about ECT, which was a great talk. So thank you again for that. And I think that's it. Are there any more slides, Christian? There we go. Okay, it's the famous QR code. So please take a look at our IPA International Congress in Kanazawa, Japan. Should be great. The QR code is there. Of course, you could check our website. And I think that's it. Unless there's any final questions. Oh, one last question. Right under the deadline here. Is there any suicide prevention services? So that's
There
a
is
question for you.
Yeah, there is a gatekeeper training program conducted by NIMANS across all ages group suicides. I think in terms of suicide prevention, the focus on elderly population is quite limited. Here, the younger population suicides are considered as a much more challenging things. But there are certain population like farmer suicides, which is a socio-political issue, which has a lot of adult population, elderly population. There is a challenge. So there are public health programs, there are NGOs working on suicide prevention. And from organizations like NIMANS also, we have been working both population-based and helplines. There are organizations providing services. And then Telemanas, again, is one of the helpline services for people with all mental health problems. And it has also been helping in suicide prevention. I think there is also one question related to advocacy. Again, I think advocacy is something very important at the central government level as well as the state government levels, regional governments. And both government and NGOs have been doing that. And we have been starting to get more support in terms of focus on dementia research and aging, including the health insurance schemes. There are some initiatives for elderly population which have started coming now. So we hope, I think Mr. Ravindra Jaiswal has pointed out, there's need for more. I think always we will have need to continue these advocacy initiatives.
Okay, so thank you. So we're at the top of the hour here, so I think we'll stop. Very much want to thank our speakers today for donating their time and for providing an excellent, clear, and comprehensive talk. So thank you both, and thank you to everybody who attended. and to Myrra and the Secretariat and Maria who work on this committee. We hope to see you in Kanazawa. If you'd like to come to the Congress, please check out those links. And it's great for all of us to stay in touch as a community of care. So thank you very much, everybody.
Thanks.
Thank you for
everyone.
presenting and for attending.
No, Myrra's
Bye.
back.
Thanks. Thanks, Myrra. Thanks.
Everyone.
Thanks, Rob.